I'm not going to sugarcoat it. Because of these cuts, too many Minnesotans will lose access to the health care that they desperately need, and even more are going to see their health care costs go up. The latest estimates put 140,000 Minnesotans in jeopardy of losing their health care coverage. Let that sink in. 140,000 of our neighbors. And right now, when you think about it, it's not that folks aren't going to come to the hospital when they need one. These healthcare facilities have a responsibility to serve our community when they're sick. It's just going to be uncompensated care that actually happens when we could be delivering preventive care that actually lowers the cost of health care in our country. I've always said that it's too expensive to be sick in this country, and that has never been more true. I don't care if you're on MNsure or if you're on a private health care plan. I am telling you now that your health care costs are going to go up. You're going to be asked to pay more because the market is already starting to prepare for what's about to happen in $1 trillion in Medicaid cuts in our country. Over 143,000 Minnesotans rely on MNsure for coverage, and 90,000 rely on the premium tax credit. 90,000, 62% of Minnesotans enrolled through MNsure will see their costs go up in 2026, with premiums increasing by $177 per month on average for everyday Minnesotans. Those bills add up.
Good morning, everyone. I want to thank Congresswoman Angie Craig for coming to Hastings, one of the most beautiful cities in my district, to talk about this important issue. I'm Senator Judy Seeberger. I represent District 41. And Hastings is not only within my district, but we have beautiful Regina Hospital, which is now United Hospital Regina campus, that I'm pretty familiar with. I work as a paramedic, as some of you may know, and am frequently at this particular hospital, transferring patients or bringing patients in for the care that they need. And I want to tell a story about what has been happening, what I've been seeing in the last few months in the back of the ambulance. About 50% of the patients that I encounter don't want to be transported to the hospital because they're concerned about how they're going to pay for it. And that's not okay. When I'm in the back of the ambulance with a patient who has chest pain, or I'm in the back of the ambulance who was someone who has been involved in a trauma, and they need to go to the hospital to seek a higher level of care, it bothers me that I have to reassure them that yes, you do need to go to the hospital. I'm not comfortable not letting you go to the hospital, but their only reservation is, am I going to be able to pay for it? That's not right. And that's not how we should be living in the United States of America. When we look at our aging population, those folks who rely on Medicare, when we look at our folks in the disability community or other communities that rely on Medicaid, they are entitled to medical care just like anybody else. And cutting those benefits, telling them that they don't have the coverage or they're not going to have the coverage that they need to treat their conditions, to monitor and manage their health, is cruel. So that's why I'm grateful. I'm grateful for folks like Congresswoman Angie Craig, who takes a stand, who fights for what's right. And I'm proud to stand alongside her within this district and throughout Greater Minnesota to ensure that all folks have health care, no matter their zip code, no matter their income, no matter their age, their socioeconomic status, their disability status, because everyone deserves health care.
Well, it's a fitting place to be here at Regina Hospital this morning to highlight the impacts of the big ugly bill, as it is called. And I appreciate the fact that this hospital is going to experience what all hospitals across the state of Minnesota are going to be experiencing, impacts from this bill. And I appreciate Congresswoman Craig coming to Regina Hospital to talk about it, to put a spotlight on it, to focus on it back in Washington as she does each and every day. As the co-chair of the Health, Finance, and Policy Committee at the State Capitol, I will tell you that we worked very hard last session to address hospital stabilization. It was the #1 priority of our committee. because we know the increasing headwinds hospitals have been experiencing for years. Low reimbursement of Medicaid, higher inflation, higher labor costs, and a growing burden of uncompensated care that has been mentioned. In St. Paul, we passed legislation to deliver stabilization, to improve Medicaid delivery, and increase reimbursement rates so our providers and hospitals could stay afloat. This Republican bill undermines that work. And it is astounding to me that when policymakers know that American healthcare systems across the country need an infusion of support, the Trump administration chooses to divest resources and add additional costly burdens to the state and providers. As mentioned, this is the largest cut in 60 years at a time when the need is greater than ever. There's no upside to this bill. The American healthcare system got a whole lot worse with its passage, and it will especially affect hospitals, rural hospitals, long-term care facilities, and they will feel these effects immediately. As mentioned, many people are going to be losing health insurance coverage, and where will they go for care? When they don't have coverage, their conditions worsen, and eventually they show up in the emergency departments of places like United Regina Hospital. They will significantly increase the uncompensated care costs for our hospitals further. And we all pay for this. We all pay with higher premiums, there are higher taxes in properties, and simply put, higher patient costs for the medical care we all need. In addition, as hospitals like this one lose revenue, they are less able to absorb those costs, putting all their service lines for the community at risk. And we see this, closures of service lines, closures of clinics, rural, urban, because of this issue. The bill also includes provisions that could reduce Medicaid funding by altering funds for arrangements for medical education. This is the very future of our preparation for the next generation of medical care. Now, this administration has declared their aim. Make America healthy again, is what they say. Their actual policy, though, this actual bill does the exact opposite, especially for the most needy, children, elderly adults, being cared for at home and in nursing homes. The question is why, and that has been answered. Tax cuts, moving to the wealthy. But remember, Republicans control government. They get to decide what policy they choose. And they are choosing health care, taking away health care for millions of Americans and giving those billionaires the tax credits. Medicaid cuts to support tax credits for the wealthiest among us are bad enough at this time right now, but I cannot talk about these cuts and the impact on hospitals without also mentioning the gutting of funding for scientific research, including $500 million for mRNA vaccine development. Cancer research has been gutted 40%. Cuts to the National Institute of Health, which promotes life-saving research in all kinds of ways, from Alzheimer's to advancements in gene therapy. These cuts have stopped trials arbitrarily, and we risk losing the leadership, the medical discovery leadership the U.S. has had for the last 100 years. This is alarming, this is shocking, this is egregious. Pick your adjective. We should all be we should all be speaking about our profound objection to this, as Congresswoman Craig does each and every day, and I applaud her for being here today to do this. The Regina Hospital, the citizens of Hastings, the people of Minnesota deserve better than this. Fortunately, my hope is that with the fall legislative session, with enough phone calls, as was mentioned, we need lobbying, we need to keep promoting and talking about this crisis on our horizon, that we can get Congress to do something different in the next term.